Hi, everybody. My name is Nicole Stefanello, and I am an addiction and mental health counselor. I work for a treatment and recovery center, and I wanted to talk to you today about one of the disorders that we treat here, and that is antisocial personality disorder, also known as ASPD as a shorter version. One of the reasons I wanted to talk about this disorder in particular is the fact that a lot more research is needed in understanding the characteristics and in the treatment of antisocial personality disorder. What is antisocial personality disorder? It's described in the DSM-5 as a personality disorder characterized by a lack of regard for society's moral or legal standards and an impulsive and risky lifestyle. It was known in the past as someone who is a psychopath or sociopath. People with this disorder are high in the quality of psychopathy. They do not actually feel any remorse for the behaviors that they have. They try to present themselves in as favorable a light as possible. I might think of them kind of as like a smooth talker. So, in essence, it's someone who just continuously violates other people's rights without any thought of what the outcome or consequence may be, because they don't really care as long as it's for their benefit. It's mostly seen in men. Obviously, women can have it too, but it is mostly seen in men, and it begins usually in early childhood. The person usually has a history of behavioral problems. It's not something that just kind of shows up. There's usually a long history in their lifetime of behavioral problems. It does lie on a spectrum, so the symptoms do vary from person to person as well as in severity. And it is argued to be the most socially destructive personality disorder, just kind of based on the symptoms and the behaviors that correlate with having ASPD. Just going in a little bit more of the psychopathy. So, as I stated before, it was known in the past to describe someone, if they had this disorder, as a psychopath, and that obviously comes from psychopathy. So this is essentially the core traits that form antisocial personality disorder. It goes back to people like serial killers who are coined as psychos, and a lot of them had the characteristics of antisocial personality disorder or had the disorder itself. Ted Bundy was probably the most famous that most of you would know that had this disorder. And that does not mean at all that someone who has ASPD will become a serial killer. It's just a little fact about it and some of the behaviors that come along with it. So the behaviors of this order, the person resorts to risky behavior despite the consequences. They fail to conform to social or ethical norms. History of early behavioral problems, like we said, or juvenile delinquency. They tend to be hostile and very irritable. They tend to lie in order to get what they want with just little to no regard for the person's feelings. They're very manipulative, and they are usually very good at it and at getting what they want. People who have this disorder tend to be charming as well, so they kind of use all of that together, the lying and manipulating, and they kind of put the charm on, and that is kind of how they work people to get what they want. And like we said, they just really don't have any empathy. They're unable to really feel bad, regardless of how bad the consequence might be or how bad it might hurt somebody. That's just not what they're focused on. They're focused on just getting what they want. They can switch personalities to fit with, the person that they are trying to manipulate at that moment. They can kind of switch back and forth and mold themselves to be who they think that person will feel most comfortable with. And this is just also another form of manipulating or lying to them. They will gaslight others instead of taking responsibility for their own actions. It's a very parasitic lifestyle, and nothing is ever their fault. It's also very impulsive. It's a very impulsive type of behavior, and they just have a desire to dominate any social situation that they're in. They really have difficulty forming deep attachments to people, which makes their relationship very manipulative and emotionally detached. It's almost just kind of like a business transaction. They usually have a reason for why they are in a relationship or having any type of relationship with someone is usually to get something. So, some of the causes of antisocial personality disorder. Now, an exact cause for ASPD is unknown, but it is believed to be influenced by a combination of genetic and environmental factors. Research suggests as much as a 50% likelihood that someone with ASPD can be explained by a genetic predisposition. It's caused by physiological brain differences, which is reduced connections between the prefrontal cortex and the amygdala. And just going into that a little bit, these are the parts of the brain that are responsible for things like empathy and guilt, fear, and anxiety. So, this also severely reduces the person's fear response, and it's just nearly impossible for them to feel, again, like we said, any kind of guilt or remorse. And that all kind of coincides with the prefrontal cortex and the amygdala. So, the major influence that I seem to come across the most in my research is the environmental influences, especially when it's combined with a genetic predisposition. The most common environmental stressors include adverse childhood experiences, also known as ACEs, and these are negative experiences that can occur before the child reaches 18 years. And this includes things like poverty, violence, and neglect. The more ACEs that are endured by a child, the higher risk they are for other bad things happening in their life, physical or mental health problems, instability throughout their life. And in regards to ASPD, there are two specific types of neglect that confirm elevated risk for developing the disorder. And that is a father uninterested in their child or a parent uninterested in the child's education. In addition to that, specific behaviors towards a child under the age of 18 months, and that is failure to greet, which is just not acknowledging or saying hello to the infant, silent interaction, so not verbally speaking to them at all, and maternal withdrawal, which is the mother just becoming cold and completely distant from the child. Another stressor is child psychopathology, and this is in relations again to antisocial personality disorder. There are certain disorders that are considered stepping stones towards ASPD, and these are specifically conduct disorder and oppositional defiant disorder. And both of these disorders early in childhood, if they are left untreated, really puts the child at a much higher risk for then developing ASPD. And chronic aggressive children are 27 times more likely to develop antisocial personality disorder compared to children who aren't chronically aggressive. Some other environmental stressors, violence, witnessing violence between parents or their caregivers, as well as inconsistent discipline. And unfortunately, we can't do anything in regards to the genetic influences besides just continued research and reporting. So the main focus really is on the environmental stressors. So some of the possible outcomes for somebody with this disorder is prison, frequent termination from jobs or unemployment, criminal violence, dropping out of school, comorbidity with other disorders. And this is really common for someone with antisocial personality disorder. Usually it is something like bipolar disorder, depression, substance abuse, physical and or emotional harm to others around them. Again, like we said, this is because they really have no empathy or regards to how they treat others or the consequences of what they do to others. And even premature death, this has a lot to do with that reckless behavior that they have, and also with substance abuse. And in the best circumstances, the best possible outcome is for the person to finally seek treatment or to get help. There are some complicating factors in the treatment of antisocial personality disorder. It's suggested that it is a difficult disorder to treat, but it's not impossible. It's common for a person to be struggling with other disorders, particularly substance abuse, bipolar disorder, and other personality disorders. And this confuses what's being treated and what is actually responding to the treatment. So, the person has multiple symptoms because they're struggling with multiple disorders. So during treatment, it is hard sometimes to see which symptom is being treated and, which treatment is working for those symptoms. So that is one of the complicating factors. Also, the criteria for improvement. Like I said before, more research really is needed in studying the characteristics of ASPD. So it's hard to measure an actual improvement in the disorder because it's just lacking a lot of that research and evidence. Also, relationship with the clinician. So because of the behaviors that correlate with ASPD, it can really affect that client-therapist relationship. The therapist can be fearful sometimes because some of these behaviors are so aggressive, which can discourage them. And sometimes even the therapist can be manipulated because, again, that is a strong characteristic in this disorder. And that's usually because the clinician isn't experienced in working with someone with this disorder. So that is something that's really important when it comes to treatment, that the clinician that the client is working with is experienced with antisocial personality disorders, and that can help avoid some of those tactics that they are used to using in, their everyday life. There is no set treatment at the moment for antisocial personality disorder, but there have been some positive outcomes with a few different treatments. Cognitive behavior therapy is used to help change the person's thinking or behavior, specifically the aggressive behavior or the impulsivity. Also, DBT right now seems to be at the forefront for treatment, and it's usually combined with treating the emotional dysregulation. Also, pharmacotherapy. So, this is used to help treat or try to control some of the specific behaviors in regards to ASPD, usually the aggressive or more violent behaviors. And these are things like antidepressants, which help regulate the serotonin levels and also to treat the impulsivity. A person with this disorder has trouble feeling empathy or excitement or pleasure, and helping regulate those serotonin levels helps with that. So, antipsychotics as well help control violent or aggressive behaviors. And they've also seen some progress with mood stabilizers, which help manage the severe changes in the person's mood. Psychotherapy, which is also described as talk therapy, and this is used to help with violence and anger management. And some of the things that professionals do agree on, again, is that more research really is needed, especially when it comes to the treatment of this disorder. But one thing that we've seen is that longer duration of treatments seems to be more effective. So it's definitely not a in and out type of treatment. It really is needed to be there for a lot longer of a time and just to really dive into the problems and behaviors in this disorder. It's also important to have an experienced clinician that's familiar with treating someone with antisocial personality disorder. Like we mentioned before, these behaviors are very manipulative, and there's a lot of lying, there's a lot of gaslighting. So it's easy for a clinician who isn't experienced in this disorder to kind of get wrapped up in it, and in the end it just isn't effective for the client. So definitely a clinician who is experienced in treating this disorder is going to be the most effective. And just a few treatment programs and resources. Life Skills South Florida is local here in South Florida and has a DBT program that is specifically for antisocial personality disorder. And they've just had some really great outcomes with this program. There's also a Personality Disorders Anonymous, and these are available online and in person. Sometimes the online is a little bit easier for people who are kind of just getting started. And, like I said, it's available online. So there are tons of classes at all different times. And it's also available in person as well. And then there is a website, khanacademy.org. And this is free online resources from pre-K to 14 years. This is really a great resource for parents as well of kids who have this disorder, and there are just an array of resources and information and numbers depending on your area on this website. And again, it's free for anybody to go on and check it out. So I hope you enjoyed this presentation and you were able to gain some perspective and some information on antisocial personality disorder. I hope to be able to contribute to the research and data that's really needed for understanding this disorder better and how we can effectively recognize and treat it. So I thank you again for coming today.